Off the top, though, we have 3,098 cases of coronavirus in Victoria. That's 165 new cases. There's some reconciliation in the data, so the global number's only gone up by 156, but there are in fact 165 new cases. 30 connected with outbreaks and 135 that are under investigation by our public health team. There are 477 cases of community transmission, 932 active cases across the state. 40 Victorians remain in hospital, with 9 of those in intensive care. Given it was the last day before the stage 3 restrictions were reimposed, it's not surprising that our test numbers off the almost 30,000 yesterday were back closer to 22,000, 21,785, but that takes us to 1,030,462 tests since the 1st of January. Again, I want to thank everybody who's come forward and got tested. I want to thank everybody who is out there following these rules. We know and understand it's difficult, it's challenging. No one's enjoying this. Nobody wanted to be in the position that we're in, but we simply have no choice as a state to follow the rules. And even in regional Victoria, there are still rules in place, and they are just as important as following the rules in metropolitan Melbourne and Mitchell Shire. If we don't all play that part, if we don't all continue to work together and take this as seriously as we have to, then we simply won't bring stability to these numbers, let alone drive them down and get to the end of this 6-week period and begin and then recommence the process of opening up. So everything is on the line here, and we need to make sure that we're all playing our part. And I want to be really clear to thank the vast majority of Victorians who are taking this seriously and are working with us to get this job done. As I said a moment ago, nobody wanted to we didn't want to find ourselves in these circumstances, but this is where we are, and we have no choice but to confront the reality of this virus and its transmission across the community, and to take the very difficult steps that we've taken, and then all of us to adhere to those rules. Our Victorian community benefits from that, your local community benefits from that, your family and every family benefits from that in so many different ways. Ending these restrictions sooner than would otherwise be the case. If we don't drive these numbers down, then 6 weeks can become longer. If we don't take this seriously, then many people will become gravely ill, and then we know the tragedy that follows soon after that. So for all of those reasons, and many more perhaps, I want to thank those who are doing the right thing, and I want to appeal to all Victorians. Let's keep working together. Let's keep taking this seriously. We simply have no choice but to do that. Now, in terms of the towers, we have conducted some 2,515 tests, which is a massive effort when you consider the challenge of moving up and down these high-rise towers, the sheer amount of work that's been done to get those tests taken and processed. There are 159 positive cases out of those tests. There are also a number of close contacts. There are, in essence, 3 groups within those 9 towers. I'll ask Brett to speak to this in more detail, but essentially 9 Pampas Street and 159 Melrose Street both have 0 cases and will be able to move to the stage 3 restrictions that apply to the rest of Melbourne. Home, except for the 4 reasons. Now, acknowledging that this is in some respects akin to an aged care facility, there will be continued support and continued protection for those residents, given that their age and for many of them their health status makes them especially vulnerable. Beyond that, we have another 6 towers that have relatively low numbers of cases, and then we have 1 tower that has very substantial numbers of cases and potentially close contacts right throughout that tower. To take you through the science of this and the different approach we're taking to each of these 3 groups of towers, I'll ask Brett to speak to that now, and then that's the what we're doing and why, and then I'll ask Lisa Neville, who is essentially in charge of our response on the ground, to explain to you how it is we will get that job done.
Thank you, Premier. So as the Premier has stated, We do have 2 towers that have been very substantially tested with 0 cases. Those 2 towers at 9 Pampas Street and 159 Melrose Street can really go to the same settings as for the rest of Metro Melbourne and Mitchell Shire. So a stay-at-home direction applies, but otherwise able to go out for those 4 reasons. But they are vulnerable individuals in those towers, and they need to be extremely mindful of the potential risk in bringing back virus into those settings. So going out has to be for essential reasons, and all of the usual precautions that we would tell anyone in Victoria need to apply especially to these elderly residents. For 33 Alfred Street, where there are at least 53 confirmed cases, and there are usually 2 or 3 close contacts for every confirmed case, we need to recognise that there might be 20–25% of individuals in that particular tower who end up developing coronavirus, and potentially more. So that has, much like an aged care facility, been designated as everyone requiring quarantine. Obviously, 5 days of quarantine have been done already, where people have stayed in their apartments, but there are another 9 days that will be required for people to be in quarantine in that particular tower. When one is in quarantine, you can go out for medical reasons, obviously. Anyone who develops illness and then becomes a case needs to go through whatever period of time until they're cleared of the virus. If they require care outside of that tower, then obviously that will be facilitated. Anyone who requires emergency assistance can obviously get it, but they need to stay in quarantine until a 14-day period is completed. For all of the other towers, and we will have new cases emerge over coming days, but the numbers are relatively less. For some, just a few cases; for others, several. We really need to have an intensive monitoring program. Obviously, for all of those cases in those towers, they need to remain in isolation. For all of their close contacts, they need to remain quarantined. We will try and facilitate movement to more appropriate settings if it's very difficult for people to isolate. That will be voluntary, but it will be strongly encouraged, because there are some apartments, as you'd expect, where it's pretty difficult to isolate from the remainder of that apartment. The other thing that will need to be supported is all of the infection prevention and control. So there'll be hand hygiene stations on every floor. There'll be very substantial deep clean every day, as well as cleaning of high-touch surfaces several times a day, so lift buttons and in stairwells and the like. The other thing we will obviously flag with all residents is a daily check-in, a single point of contact, and really emphasising that anyone who develops symptoms at any time, there'll be testing available so that anyone who becomes symptomatic can have that test, and then if they're identified as having coronavirus, can continue their isolation. Obviously, their apartment, their close contacts will require quarantine for a period thereafter. But these are the measures that we know will get on top of this. The expectation is that there will be more cases. Obviously, we've tested a lot of people over the last 5 days, but there are still people who are going to be incubating illness. So they haven't tested positive yet, but in the next couple of days, they may well develop symptoms, test positive, and will need to continue to isolate them and quarantine their close contacts. But the risk in these settings is not insubstantial, and so these are proportionate measures. As many are aware, when we've got a case in an aged care facility, every resident is considered a close contact. They are all tested. They all go into a quarantine period for 14 days. They're tested on the end of that quarantine period, and it's only then that aged care facility can really come out of a lockdown. So it's not dissimilar to that kind of high-risk setting.
So, in essence, just to run back through that before I ask Lisa to talk about all of the support and the other logistics work we're doing to facilitate this public health response. Melrose Street and Pampas Street, stage 3, same as the rest of Melbourne. Every other tower except for Alfred Street, they will be treated the same as every other resident across metropolitan Melbourne. Stage 3, but of course if you've tested positive or if you are a close contact, then you must isolate at home, and we will provide support to each and every one of those people who have tested positive or who are a close contact. If it is appropriate, then they will be moved to an alternative setting. For instance, if they were living with somebody that they needed to stay away from because of a health issue or whatever the circumstances may be, we would, and that sort of distance would not be able to be achieved in their current residence, then we will move them somewhere else, and we'll be encouraging as many of those residents to do that as possible. That accounts for 8. The Alfred Street Tower, though, is a different case, and the public health advice is that there are such numbers of positive cases together with known close contacts that the assumption has got to be that everybody in that tower is a close contact of someone who is positive. On that basis, just like every other Victorian, they will need to remain in their flat, in their unit, except for medical care and for supervised daily exercise. We will support each and every one of those families. The 14 days is the balance, so the 5 days that have already been done, plus a further 9 days. And that is an abundance of caution approach that not only protects the welfare and the well-being, the health of all of those residents, but also protects public health as well. We are in a strategy at the moment to try and drive down numbers, and we therefore need to take some hard decisions, some difficult decisions, but those based on medical advice in order to achieve both good outcomes for individuals and their families, but good outcomes for communities and indeed our whole state as well. And that's exactly what these decisions represent. To talk you through some of the practical matters in terms of groceries and other support, medical support, all of those things, I'll now throw to Minister Neville.
Thank you, Premier. Good afternoon. So this has been pretty tough for a lot of residents at the Flemington and North Melbourne high-rises, that people's homes being locked in there for 5 days. It's been very tough. And for some, it's going to continue to be tough over the next 9 or so days. What I would say to people, though, having been out there yesterday at both sets of flats, is that there is such an extraordinary amount of outpouring from the community, from all our agencies, our volunteers, our career agencies, in terms of wanting to support people. So I hope people take heart by the fact that so many Victorians have reached out and want to be part of this and share part of this with those residents. As the Premier and the Chief Health Officer said, we've got 2 towers that are about to, if not already, have been lifted from the directives and are now at stage 3. Those 2 towers will now receive quite significant in-reach help, like we would do with any other aged care facility. So we will provide support, health and other support to those residents who are already vulnerable and are probably not really leaving their homes anyway. So we will provide all that support that is needed, and that will be largely a health response there. There will remain some police just around to ensure public safety and people are following the restrictions. In terms of Alfred Street, and I think this is the really difficult one, and I know that this is not an issue that anyone has taken lightly. I know the Chief Health Officer hasn't, none of the agencies, about ending up in a position where we've got another 9 days where people are locked in their homes. This is really going to be really tough for them. What I can assure them of is that we have a plan in place. It's not just a policing plan. There will have to be police there to ensure people's safety, but also to ensure compliance with quarantine. It's very clear. The message from the health authorities is very clear. We can't allow people to be moving across floors or in lifts because it is such a high-risk environment in that particular tower. We will have that policing support, but we'll also have support from health. There will be care teams, there will be support teams that are available to people as they get through a really tough 9 days. We're also moving our food, both production, generation and distribution system, and we'll do that over the next couple of days to AMSA, the Australian Muslim Social Services Association. That is based down there near North Melbourne. They are doing already a massive job, and I know last night they were able to deliver a significant number of meals to people. So we will support them to get groceries, to provide those groceries, to provide both perishable and non-perishable food, and we'll have a much more scheduled system around that, and they can also deliver those, and they, from experience, it's about a 45-minute delivery time through those towers. So I thank them for putting their hand up. That means we are able to deliver more appropriate food, more culturally appropriate food, and we have a better, they've got a very strong connection into those communities. In addition to that, we'll continue to provide our medication, etc. These residents in Alfred Street, one of the differences will be they will be able to access exercise and fresh air, and we'll be working through that with the health teams and with the police about how we do that as safely as possible from a health perspective. We need to schedule that in a way where you don't have large numbers of people all at once going out, but that is obviously a very important part of people's wellbeing, and I think that will at least help a little bit during the next 9-day period. In terms of the remaining 6 towers, so for the vast majority of people in those towers, they move to stage 3. At this stage, it will be about midnight tonight, and the reason that it's not immediate for those residents is that we can't afford to see a couple of thousand people try and exit straight away when they've known they're able to move out. That would have massive issues around social distancing and potential risk to the spread. So we are making it later so that we've got a more ordered way in which people can leave. So food will still continue to be provided, and there'll still continue to be significant police presence in that area. We'll also, in terms of those who are required to quarantine, those who have COVID or who have a close contact, we will be knocking on their doors and strongly encouraging people to take up the offer to go to hotels. That will be available from midday tomorrow. In fact, for those who really want to go now, that is available tonight. But people have an opportunity to think about it, to actually prepare. We will then be able to transport people through Ambulance Victoria, those who have COVID, and St John's Ambulance for those who are close contacts. We do really encourage that. That is the safest for you and the safest for everyone else in those towers. However, if people are choosing to stay, there will be, as police do out in the community, no different to anyone else in their home where they're required to quarantine, regular checks on people, whether they are abiding by those quarantine. There will be care teams that will be supporting each of those people who are quarantining. But I can just strongly emphasise, if you are going to choose to stay, you must quarantine. This is so important to the health and well-being of the rest of the residents in those towers and also in that broader community. In terms of the other support that will be available on site, there will be medical teams. There will also be, this is across all the sites, there will also be health temperature checks, there will be symptom checks available, there will be regular testing available for people as well. We'll be closing all the shared laundries across all the sites, and we will provide laundry support services, and that'll be done through a company to ensure, one source in and out. We don't want people in those shared spaces, and as the Chief Health Officer said, there'll be deep cleaning on every floor as well as regular checks on spot points. So for those residents who are in those 6 towers who are not a close contact or positive, you will be able to go about as per every other Melburnian from about midnight tonight. But again, you've got to follow those restrictions, those stage 3 restrictions, and we'll continue to have a lighter police presence in those 6 towers. That'll be much more a health response than it will be a policing response, but they will be there for public safety and to provide any assistance that communities want. This will be a program that is led with the Emergency Management Commissioner out of EMV. It is a significant operation, and we'll continue to work with all the health experts to make sure that we're meeting people's health needs, keeping people safe, as well as making sure that in terms of a broader public safety that we have the resources that we need there. Again, can I thank our police? Can I thank all those volunteer SES, Life Saving Victoria, Forest Fire Management, Fire Rescue Victoria, who have been delivering food. I think we've got 210 people there today just delivering food. So I thank them. I thank the local community, AMSA, for putting their hand up around food delivery. That's going to be such a big difference. And can I particularly thank the residents? This has been really tough. And, you know, you have done this not just for your own health, but to help the rest of Victoria. So I thank you again.
Very good. Happy to take any questions you have.
Can I just ask the Chief Health Officer just for your take on this, the numbers today, the second highest number we've seen. Is this what you expect?
I don't know what to expect each and every day. I always hope that numbers will turn the corner. We've obviously had some changes in recent days that I would hope have helped to suppress transmission, but it's only with these stay-at-home directions that I really have confidence that we can properly drive it down. So I still think we're right on the cusp. It's a number that I absolutely hope continues to be driven down. I wouldn't expect that this is the peak. I absolutely keep my fingers crossed that it is. It would be most reassuring if in the next week we can see numbers go down, but there's absolutely no guarantee. And I've emphasised so many times that we can't be complacent. And when we've had a day that's gone down, we've seen another day where it's gone up really significantly. And part of the reason for that is sometimes that outbreaks get significant new numbers. We may well see from these towers more confirmed cases from overnight. So, you know, we'll keep watching those numbers very closely.
And how many